Hey everyone, and welcome back to Study Nurse IQ. I'm Jenny, and today we're tackling a topic that's fundamental to respiratory care: the medications used to manage conditions like asthma and COPD. Whether you're a new student or just need a refresher, we'll break down these drug classes in a way that's easy to understand so you can walk into your next exam with confidence and, most importantly, provide excellent patient care. Let's get started. The rescue versus controller inhalers, beta agonists. When it comes to managing conditions that cause bronchospasm, like asthma and COPD, we think of two main types of inhalers: the rescue inhaler and the controller inhaler. These are both part of the beta receptor agonist class, but they work in different time frames. Short-acting beta agonists, SABAs. These are your rescue inhalers, designed for rapid relief of acute symptoms. The prototype you'll see most often is albuterol, also known by brand names like ProAir or Ventolin. It works quickly to relax the smooth muscles of the airways, opening them up to make breathing easier. Since it's a rescue medication, it's used as needed for sudden flare-ups or before activities that might trigger symptoms. Long-acting beta agonists, LABAs. These are your controller inhalers, intended for long-term prophylaxis and prevention of symptoms. They should never be used for an acute attack. A common example is salmeterol. LABAs have a longer duration of action and are used in combination with other medications for ongoing management of bronchospasm associated with asthma, bronchitis, and COPD. A key teaching point for all beta agonists is the potential for side effects. You might see patients experience tachycardia, an increased heart rate, palpitations, or a feeling of shakiness and tremors. These side effects are usually transient and fade as the body adjusts to the medication. It's also crucial for nurses to know the correct order of administration. Always use the rescue inhaler before the maintenance inhaler. This opens up the airways first, allowing the maintenance medication to get deeper into the lungs and work more effectively. The anticholinergics. Another important class of inhaled medications are the anticholinergics. These work by blocking the bronchoconstrictive effects of acetylcholine, leading to bronchodilation. Ipratropium bromide Atrovent is a short-acting example. Tiotropium bromide Spiriva is a long-acting one. These are used for both COPD and asthma. The most common side effects are a cough and dry mouth. These medications are not meant for acute bronchospasm, so we would not use them in an emergency situation. The anti-inflammatory agents, corticosteroids. These medications are powerful anti-inflammatory agents that help reduce airway swelling and hyperresponsiveness. They come in two primary forms: inhaled corticosteroids, ICS. These are used for long-term prophylaxis and can take anywhere from 1 to 4 weeks to reach their full effect. Examples include budesonide, fluticasone, and beclomethasone. Because they can cause throat irritation, hoarseness, and dry mouth, it is essential to teach patients to rinse their mouth with water and spit after every dose to prevent a fungal infection called thrush. Oral corticosteroids, medications like prednisone, are used for the short-term management of acute exacerbations. Long-term use of oral steroids can lead to serious side effects, including fluid retention and a characteristic buffalo hump, as well as hyperglycemia and immunosuppression. The theophylline and others. Theophylline is another bronchodilator, but it's used less frequently now due to its narrow therapeutic range. This means the line between an effective dose and a toxic dose is very thin. We must monitor blood levels carefully to avoid toxicity, which can lead to serious side effects like seizures and life-threatening cardiac arrhythmias. We also have leukotriene modifiers such as montelukast, Singulair, which block a specific inflammatory pathway in the body and are used for both asthma and seasonal allergies. Finally, mast cell stabilizers like cromolyn are used for asthma prophylaxis, but have largely been replaced by leukotriene modifiers. Let's test your knowledge with a few practice questions. Question 1. A nurse is providing patient teaching for a client with asthma who has been prescribed a long-acting beta agonist, LABA. The most important instruction for the nurse to include is: A. Use this inhaler only when you feel an asthma attack beginning. B. This medication can be used to treat sudden shortness of breath. C. Use this inhaler daily for long-term prevention, not for a rescue. This medication is a steroid and requires you to rinse your mouth after use. Correct answer: use this inhaler daily for long-term prevention, not for a rescue. Rationale: long-acting beta agonists, LABAs, like salmeterol, are designed for long-term prophylaxis and should not be used for acute symptoms or as a rescue inhaler. SABAs, short-acting beta agonists, are the rescue medications. Question 2. A nurse is teaching a client with COPD about the correct use of their new inhalers. The client is prescribed both an albuterol inhaler, a SABA, and a tiotropium inhaler, a long-acting anticholinergic. When explaining the correct order of use, what should the nurse tell the patient? A. Use the tiotropium inhaler first, then wait 5 minutes before using the albuterol. B. Use the albuterol inhaler first, then wait 5 minutes before using the tiotropium. C. The order does not matter as long as both are used daily. Use both inhalers at the same time to ensure maximum effect. Correct answer B. Use the albuterol inhaler first, then wait 5 minutes before using the tiotropium. Rationale: the albuterol is a short-acting bronchodilator that will open the airways, allowing the long-acting tiotropium to penetrate deeper into the lungs and be more effective. The rescue inhaler should always be used before the maintenance inhaler. Question 3. The nurse is educating a patient about their new inhaled corticosteroid, ICS. Which of the following is a crucial piece of patient education to prevent a common side effect of this medication? A. Take this medication at night to prevent insomnia. B. Be sure to rinse your mouth with water and spit after each dose. C. Report any signs of an increased heart rate or tremors immediately. This medication can cause constipation, so increase your fiber intake. Correct answer: B. Be sure to rinse your mouth with water and spit after each dose. Rationale: inhaled corticosteroids can cause oral candidiasis, thrush, due to local immunosuppression. Rinsing the mouth with water after each use helps to remove any residual medication and significantly reduces this risk. I hope this review on respiratory medications was helpful. If you found this video valuable, please hit the like button and subscribe to our channel, Study Nurse IQ, on YouTube for more simple and clear nursing content. Thanks for watching.